Hi,
Hi.
Dr. Stroman.
Hey, how you
I'm
doing?
great. How are you?
Okay.
Good, good, good. So, first, I want to thank you so much for taking out the time to be here on my platform, Healthcare Corner Talk, to share your wisdom in mental health and psychiatry. It's such a pleasure to see you, someone that's a reflect of the community, to practice, in mental health. So, without further ado, the first thing I like to do is allow you to have some time to tell us is Dr. Stroman. Who is Dr. Stroman? So,
Okay.
hand it off to
Aw.
you.
Yeah, so I originally grew up in Detroit, Michigan, and to a single parent mom. And I always like to say I was raised by a village because I grew up with my grandparents during the day while my mom was at work. And so, yeah. And then my aunt who lived downstairs, she had a heavy influence on me, especially within like performing arts. She kind of like took me along to like the libraries on Saturdays and to like ballet on the weekends and like choir rehearsal and
Wow.
cheerleading. And then also she was a social worker. So she was the reason why I became a psychiatry resident now, because I would go to work with her a lot and see her clients and things. And she was also a substance abuse therapist as well. So,
Okay.
and I just saw how she interacted with people in the community that struggled with like drugs and other substances and alcohol and mental illness. And so I kind of, from that point, like, was like curious about mental health myself and like why people behave the way they do. So, yeah, right now I am a second year resident at the University of Michigan. That's where
Nice.
I'm training now in Ann Arbor. So, yeah, I'm living in Ipsy now.
Oh, okay, nice, nice. Well, our childhood definitely has a high influence on where we end up, what role we take in life. So that's really nice that your aunt was that influence for you to help you, to take on this journey as a mental health professional and a woman, and African American woman at that. So much commended, for you taking on that, and I'm so happy to hear. Um, Now, one of the things that, I'm big on health literacy. So we want to make sure that we help our audience understand what are we saying, what are we talking about. And I feel like a lot of times psychiatry, psychology often gets mixed together.
Mm-hmm.
So,
Yeah.
yeah, and there is a difference. And if you don't mind helping the audience understand, what is the difference?
Yeah, so psychiatrists, they are medical doctors. They go to medical school. So I didn't mention that I went to Wayne State School of Medicine in Detroit. It's a 4-year program. So they go through medical school so they can prescribe medications. Um,
Mm-hmm.
and so we also do evaluations, assessments. We come up with treatment plans. Um, and also we can do psychotherapy, but it's like um not such a it's like not the primary focus of our practice,
Mm-hmm.
although you can implement that in your training. Like for my program, you have opportunity to do a fellowship, like a year long, I think, fellowship where you
Oh,
get a certificate in psychotherapy, which I'm planning to do because I've just always been curious about it.
mm-hmm.
So then you have the psychologists. They're like doctor of philosophy, or they have like what you see like a PSYD, or like doctorate of psychology.
Mm-hmm.
Um, and so they also can do evaluations, assessments. They can diagnose just like us, but they can't prescribe medications. I think some states they can,
Okay.
but it's very limited.
Hmm.
Yeah, yeah,
Okay.
because
Well,
different modalities of training kind of we look at like the neurobiology and things like that, and like physiology, underlying physiology of mental illness and stuff like that. They
hmm.
kind of focus on like the emotions, emotions and feelings and behaviors, and psychotherapists, they could be social workers. um so a lot of times they have their masters in social work,
Okay.
and they can counsel. You have like family counselors, you have marriage counselors and things like that that can provide like talk therapy too. But usually, like if you have a psychology degree and you're a doctorate, like a doctorate psychology degree, you have a multitude of like modalities you can choose from. Some from cognitive based therapy to like dialectical based therapies. And then if you want, I can explain like the difference of those. But like at this point in my training, we kind of focus more on like acute inpatient mental health stuff. So psychotherapy is not something that I'm too knowledgeable about until like third year. That's when we have exposure.
Okay, okay, good.
Yep.
Yeah, well, yeah, that's coming down the road, so that's good to know. And just thinking about the stigma in mental health, you want to touch a little bit on that, talk about that, anything that you've noticed from experience or even just, working in your residency.
Oh yeah, most definitely. You can see it a lot in the Black community, where there's this reluctance to kind of open up and talk about or acknowledge that you're struggling mentally. There was a study I know with the NIH that looked at a survey of about almost 300 African Americans between the ages of 25 and 72. And they looked at not just African Americans as a whole, but like, the age differences, generational differences and things like that. And you saw that like elderly African Americans kind of looked at like depression, for instance, as a weakness. And that study also showed that like I said, not willing to open up and acknowledge you're struggling mentally. But concerned about the stigma. It's heavily stigmatized, obviously, or just hearing, just colloquially, like,
Uh-oh. There we go.
you got me?
I lost audio a little bit, but I got you back now.
Okay. Yeah. So what was I saying?
Yeah. The stigma, and how the elderly associate that with weakness.
Yeah.
And that, yeah.
So
and that go ahead.
And I was getting ready to say like, although, in that study it showed like, although African Americans, they actually think it's a good thing that mental health services exist. They generally think it's a good thing. It's just that we don't seek it out ourselves. And I think it's a mixture of mistrust, and also kind of like we tend to, that study also showed we tend to want to use religious coping, talk to our ministers, our pastors, things like that, or other people in the church, rather than going to see someone like myself or a therapist.
Right. Yeah. And that, that's unfortunately, that is understanding. And not to even I want to mention this because I think it's relevant to speak about. I seen a reel the other day with 50 Cent, and he was saying that depression is a luxury, and everyone was like going off in the comments. And I think what he was really trying to say is that people use it as a crutch, not so much as a luxury. His whole rationale was, when you're in a certain community where you're not fortunate, you don't have time to be depressed. You got to do what you got to do. You got to go to work, even though you don't want to be at work. You got to feed your kids. You got to, take care of your family, even though you may be feeling down. So he said depression is a luxury. And I feel like he was really trying to say it's used as a crutch. But needless to say, having mental illness is associated with weakness, unfortunately, among culture such as African Americans, because, it's like we taught to hold our emotions, strap up our boots. We got to just do what we need to do to get through. But when mental health is untreated for so long, then it does turn into worse, worse problem, right?
Right.
So
And that's absolutely.
Yeah.
disability, because eventually you're not going to be able to function well. You start bleeding basically out, like where other people can notice it. It started to be so invasive where you can't function at work or at school. You can't take care of your family. You know what I mean? You're not yourself, and like probably have to eventually take off work or lose income that way. So it can spiral
Yeah.
out of control quickly if it's not, intervened.
Hmm.
Yeah.
And just going back what you said about the disability thing, I know I had read a statistic that mentioned that depression is one of the primary disability, the highest reason for disability in the U.S. So the
Mm-hmm.
thing is that, when you keep, holding off care, it's going to trickle down in your everyday life. You're not going to be able to keep a job. You're not going to be able to sustain yourself like you're supposed to. And it also affects your physical, health. A
Yeah.
lot of times mental health and physical health is separated, but they actually work in harmony with
Yeah.
each other.
So true.
Yeah. Yeah.
There was a point where when I was a medical student and I was working in an ambulatory care, that's outpatient care basically, at Henry Ford, and there was a lady that she was there. She had like uncontrolled blood pressure or diabetes or something chronic that she was coming to the doctor for, and it was out of control. But she was like, if I can get my depression under control, then I could worry about taking care of my physical health.
Hmm.
You know what I mean? So depression can be so, like you said, debilitating. It can be, you can't get out of bed, or you don't feel like getting out of bed. It's like you feel like leg. You're not motivated. You
Hmm.
stop taking care of yourself, like brushing your teeth, bathing. So how are you gonna be able to take your medications if you're that way, you know what I mean? Or even care if you're having thoughts of suicide. We call it like passive suicidal ideation, where you may not do anything like pull the trigger, but you stop eating in hopes that you just might pass away that way, or you stop taking your medications hoping that maybe I have a stroke or a heart attack and I'll die that way, you know.
Hmm.
So yeah.
Yeah. Yeah. It's it's a, especially right now in America, in the world period, mental health is an issue, but I know in America it is a mental health crisis, and a lot of that has been exacerbated because of the COVID-19 pandemic. But even previously I had read like there was trends showing how it was increasing, but it exacerbated when COVID happened. So
Mhm. Yeah.
um, yeah, and this is why there's so many initiatives. A lot of people, talking about mental health because we want to make it a social norm. Uh, we want to get that stigma, remove that stigma and make it normalized, right? It's okay to seek help.
Yeah.
It's okay to even experience a mental illness. Like, it has nothing to do with weakness. There's many factors that contribute to people, experiencing mental
Yeah.
illness. One of the things I'm just thinking I would like for you to kind of touch on is clinical depression, because like sometimes we get sadness and clinical depression confused. And could you touch
Hmm.
on? Yeah,
Yeah.
exactly. Yes.
Yeah, so in psychiatry, a lot of times we're looking at timelines, or like how long it's been going on, um, how are you functioning differently because of your sadness. So like for major depressive disorder, it's a minimum of 2 weeks
Hmm.
of like sad mood obviously has to be a part of it. But we look at your sleep. Are you sleeping less? Are you, having trouble falling asleep, staying asleep? Um, and we look at like, are you like have you stopped um just participating in things that you used to find fulfilling? So like
Hmm.
sometimes you may continue to do those things. Like I remember I came across a patient who had a gaming addiction, and he was also depressed, so he was still play his games, but it didn't bring fulfillment like it used to bring. So
Hmm.
or so you look at that, we call it anhedonia. We look
Okay.
at if you have inappropriate guilt about things that happened years ago, or um, guilt kind of like in the forefront of your mind. We look at like your energy levels. Are you fatigued all the time, kind of feeling like lead? We look at, how are you concentrating? If it's, low, That's also another indicator for I'm talking about 2 weeks. This is
Yeah.
this should be going on for 2 weeks every day or most of the days of the week, and kind of like all day, and kind of like affecting you functionally. Like you can't make a decision. You're very indecisive where people can notice it. And
Mm-hmm.
then appetite. You know, if you're having like 5% of weight gain or weight loss within a month, then that's alarming. That's you know, without trying, that
Mm-hmm.
telling that there's some depression going on. And then what we call psychomotor agitation or psychomotor slowing, where you move and think slow, where other people can notice it.